Hi, folks. Dr. Ed Beyer, Clinical Director of Beyer Stem Cell Institute in Tinley Park, Illinois. Today, we're going to go over how we use properly stem cells for regenerative medicine. Now, just to let you know, I have an hour-long video of this that I found a lot of people don't want to sit through that long. So I've kind of chopped out some of it and condensed it into hopefully about a half an hour here, or 20 minutes maybe, I don't know. So if I go too fast and there's some concepts that you really don't understand, you can always access this hour-long video on my website, BeyerStemCellInstitute.com, or click the link below. But the main points of the seminar are contained in this video. So let's get started. Now, also, one of the reasons why you want to watch this video in its entirety, you're going to learn exactly how to properly use stem cells to regenerate arthritic joints. So many people are out there doing it and are not doing it the right way. And at the end of the video, I'm also going to cover the exact cost. And also at the end of the video, I'm going to give you an opportunity and a private phone number to actually consult with me. No obligation to say, am I a good candidate for this or am I not? And what should I do? It's just an opportunity to really get checked out. And that includes actually taking x-rays. So we're partnering with medical doctors all over the country. So if you're watching this outside the city of Chicago, there's a very good chance that we can hook you up with a clinic in your area. But I do all of the consultations. So those can be done virtually via Skype or phone. So what we're going to cover is basically what are stem cells and what do they do, the proper type and source of stem cells used for joint regeneration. That's very important. What two things have to be in the stem cells to work? We're going to compare stem cell regeneration to what your traditional medicine doctor gives you, the research and how to research it, who's actually doing this. You're going to be surprised with some major institutions that are already doing this. The FDA, Big Pharma, what's the deal? Are they in or are they out? And could it be right for you? Because it's not right for everybody. And then at the end, like I said, I'm going to go over the exact cost. So look, there's three ways that our joints break down. You can have an injury, like a car accident, and your neck's never the same. Repetitive trauma is probably the most common one, just wearing out the joint. Like my dad was a plumber. He wore out his elbow and his knees, just using it over and over and over. And then there's autoimmune disease, certain autoimmune diseases like rheumatoid arthritis, lupus, psoriatic arthritis, where the immune system's actually attacking the joint. Whatever the mechanism is, the end result is the same. You can't move. You're starting to lose your ability to be independent, and you're in pain. Now, I want to go over exactly what are stem cells, right? So when we're born and we're fully formed at birth, we have about 210 cells that make us up, and all those cells are very different. Heart cells are different than brain cells, etc. But it's not that way when we're created. When we're created, we got mom's egg and her DNA and dad's sperm and his DNA, and they join forces and they form one cell, and that cell is called a zygote. Within a week, that zygote becomes a group of about 50 to 100 cells called a blastocyst. Now, this is where things get interesting. Those 50 to 100 cells, they actually have the full potential. Each one of those cells can become any one of those 210 cells that make us up. And that's what they do. They go through a process of differentiation the 40 weeks that we're in mom's womb. Once they differentiate, they can't go back, right? Then they also go through another process that most of you don't know called derivation. Some of those embryonic stem cells, early embryonic stem cells, they don't become specialized cells. They actually mature into adult stem cells. And by the way, folks, we do not use embryonic stem cells. Because people ask me, do you aborted fetuses? And all? No, those embryonic stem cells are used for research, and they're obtained through in vitro fertilization labs. So don't be that person that thinks that aborted fetal tissue is used for stem cells. It just isn't true. Now, by the time we're born, 1 out of 10,000 of our cells is a stem cell. It's an adult stem cell when we're born. And the reason is because when we hurt ourselves through an injury or disease, those dead cells release chemicals, and these adult stem cells go to that area and make new cells. For example, I cut myself, I destroy skin cells. Skin stem cells will go to that area and make new skin. Break a bone, same thing. Heart attack, same thing. Twist my knee in a football injury, same thing. The problem is that as we age, the amount of these stem cells go down and the potency goes down. You guys already know that. Who's going to heal quicker, a 6-year-old that breaks a bone or a 60-year-old that breaks a bone? Because a 60-year-old has less stem cells. They're not as potent. So as we age, our ability to regenerate goes down, and our degeneration goes up just with chronic use. Now, mesenchymal stem cells are the particular stem cell that's available to us that's in our own body, but they decrease as we age, that repair joint tissue. So, and joint tissue, what I mean by that is cartilage, ligaments, because people ask, well, I have a ligamentous, I have a rotator cuff. I got stem cells for a rotator cuff. That's not a cartilage problem. That's a tendon problem. And it was a very successful thing for me. So they can repair any joint tissue. There's 2 sources of these mesenchymal stem cells. They're in our own body in bone marrow and fat, but they decrease with age. And then they found mass quantities of them in human umbilical cord tissue. That is the best source of stem cells because they're mesenchymal stem cells for joint repair because they're young and they replicate quickly. Don't go somewhere where they pull your own stem cells out and inject them into your body. It works for a lot of people, but not nearly as powerful as using brand new human umbilical cord tissue, which we're going to talk about. So that's the best source. There's an area of the umbilical cord called Wharton's jelly, and we'll talk later on how we actually get that, and that's all FDA regulated, how we get these stem cells from the umbilical cord. That's the best source. They also contain these protein byproducts called exosomes. That's really important to allow the stem cells to work. So we're going to compare stem cells to what we traditionally get from our traditional medicine. Let's talk about cortical steroids. A lot of you have had cortical steroid injections, especially for the knees. Probably 65% of what we see in our institute are knee problems because the knee is the major weight-bearing joint in the body. It's the number 1 joint to destroy through the arthritic process. So cortisone injections or taking prednisone or oral corticosteroids, they're great at reducing inflammation, but at what cost? As soon as you get that injection, it destroys the cartilage, right? It decreases inflammation temporarily, but it actually destroys the joint. It also destroys your intestines, raises blood pressure, causes cataracts, causes bad skin issues, and it disrupts your own natural corticosteroid called cortisol, which can lead to thyroid issues and a lot of negative things. So what I hear all the time is, yeah, I went and I got a cortisone injection in my knee, and, it worked for like 4 months, and then it wore off, and then I got another one, and it worked for 2 months, and I got a third one, it didn't work at all. Because the moment you put that injection in your knee, it starts to destroy the knee. So cortisone destroys our joints. It eats our joints. It's not a long-term strategy, folks. Please realize the negative consequences of corticosteroids. Then there's the non-steroidal anti-inflammatory drugs, the NSAIDs like aspirin, ibuprofen, Aleve, Celebrex. They destroy the gut. I just read a study that if you take 10 to 20,000 people every year die from the proper use of these medications through stomach ulcers and bleeding and things like that. Same thing with prednisone. If you take prednisone, going back to the steroids, for 10 days, your chances of getting osteoporosis go up 270% the rest of your life. If you take prednisone for a year, which is a corticosteroid, your chances of developing osteoporosis go up 21,000%. Come on. So you need to be aware of this, okay? So these non-steroidals really cause a lot of problems in the gut and in the stomach especially. Then there's the opioid drugs. Folks, I don't need to get into the side effects of this. 60% of people that get addicted to opioids start out taking it as a pain reliever. I love this expression, we are not made of drugs, we are made of cells. If you're suffering with a degenerative knee or any type of degenerative arthritis, hip, back, it's there because you don't have enough mesenchymal stem cells to heal it as quickly as it's degenerating. Now you have this option, if you're a good candidate, of doing it the right way to rebuild the tissue in that joint. Now, when I get to this point of the video, I always like to ask the question. I want you folks to think of 2 changes you can make in your life right now that would make you healthier. 2 changes you can make. You know what I never hear? Maybe you thought about it, maybe you didn't. You know what I never hear? I need to take more medication, right? I never hear that. So here's the truth. The United States is 5% of the world's population. We consume 72% of the world's pharmaceuticals. It is a pharmaceutically driven system, right? And Big Pharma controls it. They also control what insurance companies will reimburse. So I'm going to share a message with you that you may or may not like. Just don't get mad at me because don't get mad at the messenger. I'm just telling you the truth. If you want quality, natural care for a chronic problem, don't expect your pharmaceutically driven health insurance to cover it. Why would a pharmaceutically driven system cover something that's going to get you off the pharmaceuticals? It doesn't work that way. And should it matter to you? A lot of you are hobbling around on a bad knee, hip, or whatever, and you're just not enjoying life. And you'll spend money on this and that and this and that. To me, you know, if my health is gone, that's where I want to invest my money. So I get into the cost at the end because only you can answer the question, is it worth this much money to get this better? So this is right out of the Medicare Guidelines, a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. That's right out of Medicare. Okay, other injections, you got hyaluronic or gel injections. We do those. In fact, our stem cell injections include hyaluronic acid. We're going to get into that later. And then there's PRP, which is taking your own platelets and injecting it into the joint. These are temporary. They work, but they're temporary. They actually don't regenerate the joint tissue. They don't regrow new tissue like stem cells do. Then there's surgery, right? The joint replacement or cleanup surgery. Joint replacement, there's a lot of downtime, right? We got 3 to 6 months of downtime. They don't always work. There's a lot of studies. A lot of knee replacements are so unnecessary. And there's studies on that too. They only last so long, then 50% of you are going to need another one. And, you know, talk to people who had knee replacements. Mostly they're not too happy with it. And there's a high cost in time, pain, and money, a lot of downtime. With stem cells, zero downtime. I've had it in my thumb, my shoulder, my left knee, and my right foot for plantar fasciitis, and every one of them was successful, and there was no downtime. I could work the same day. People drive to our clinic, drive home. So we're just putting cells in your body that you already have. You just don't have enough of them. So all these medical status quo treatments, what they have in common is they don't regenerate your tissue. Properly done stem cells is the only way, the only option we have to actually regrow new tissue. So now what stem cells, mesenchymal stem cells do, they do one of two things. Now this is a very important concept. They're going to differentiate into joint tissue. They're going to regenerate whatever you need in that joint that's being injected. But they're also going to self-replicate. They're going to make another one of themselves. And that's a very important concept that we're going to cover. So our bodies are self-healing machines. They use stem cells as our own internal repair system. Any healing event is a stem cell event. So here we see a patient right here who was told he needed knee replacement. On the left, you can see bone-on-bone knee. We did one mesenchymal stem cell injection, properly done, ultrasound guided, umbilical cord, with follow-up, with exercise. Look at his knee 8 months later. So this person was able to avoid surgery, was very, very happy. Stem cells regrow tissue. They don't heal bad, dead cells. They make new ones, okay? Very important concept. Some people have a hard time understanding. Here's how you want to research this. You don't want to go to Google and just punch in stem cells. You want to go to Google and you want to punch in mesenchymal stem cells and joint regeneration, okay? You got to get in the ballpark. And only look at the research that comes from PubMed, which is the National Institute of Health, which is a non-biased search engine. There's over 6,000 pages of this stuff, and it's all favorable. And your doctor, okay, I'm going to go talk to my doctor. Let me tell you, 99% of doctors have no clue about stem cells. They have an opinion. You know, to me, an opinion that's not based on knowledge is dangerous. So my opinion, my experience is that they don't really know anything. So just go and look at it yourself. There's no doctor that's smarter than Google, okay? So mesenchymal stem cells and joint repair. You'll see it. Even Mayo Clinic is doing this. I took this right off their webpage. Mayo Clinic doing stem cell therapy they have their own regenerative medicine section. They do that for knees, and here's another one on their website for hips. So Mayo Clinic, one of the most respected institutions in our country. It's good for these mesenchymal stem cells are good for joint repair, right? Knees, hips, shoulder, any joint. Don't be misled. People call me, what about liver cancer and macular degeneration? No. There's two other conditions that may help. Erectile dysfunction, because the breakdown of the arteries, the tissue there is it's the same as joint tissue. And COPD, the endothelial layer in the lungs, is also similar to joint tissue too. So there's potential there. But we primarily use it for knees. And COPD would be done via infusion. So there's 6 points to successful stem cells. Number one, you got to make sure that the cells come from an FDA-regulated lab, which ours are. You got to make sure that you use human umbilical cord, not your own. You got to make sure that the injection includes hyaluronic acid, which acts as a scaffold, like a mesh, so the stem cells have something to cling to. You got to make sure that there's exosomes in the injection. We talked about that. You got to make sure that the cells are cryogenically frozen right up into the injection. And you got to make sure that you do range of motion exercises to the joint at some point. We usually meet with the patient 8 weeks after the injection to get them going, okay? So another point that's kind of important too is we like to use ultrasound guided injections, so that makes sure that the doctor is very accurate with the injection. So as we get older, we make less and less stem cells. When we're born, remember we said 1 out of 10,000 of our cells is a stem cell. By the time we're 60, which is what I am, it goes down to 1 out of 400,000, right? And at birth, our stem cells replicate every 28 hours. So that's 1 billion new ones every month. By the time we're 60, it's every 60 hours. It's only 200 new ones per month. That's why you don't want to use your own. You want to use umbilical cord. So the sources of stem cells, you have embryonic stem cells. We don't use those, okay? Don't be that person. They're used for research. And then there's adult stem cells. Now, adult stem cells can be your own or it can be from a donor. Now, here's a point I want to make. Human umbilical cord stem cells are adult stem cells. Let's say it again, because people get confused. Umbilical cord, embryonic. No. Human umbilical cord stem cells are adult stem cells. They're not embryonic stem cells. The baby's fully formed, so they're adult. And the other thing is, so we use human umbilical cord stem cells donated. We're going to get into that in a little bit. They contain mass quantities of mesenchymal stem cells, some hyaluronic acid, and also they're immune privileged. So like with blood, you have the blood type. You don't have to do that with stem cells, right? As long as they're from umbilical cord. No one has an immune reaction to these. So what happens is when a mother is pregnant, the hospital will ask her, look, when the baby's born, you might want to like store or put your birth tissues, the placenta, umbilical cord, amniotic membrane, amniotic fluid, in a tissue bank, because there's certain childhood disorders that a baby could have during the first year that they would benefit from that tissue, right? So after a year, when the baby's fine, the mother consents to be able to give these tissues, to donate them, okay? So that labs can buy them. So they're sent to a tissue bank and a blood bank, and their sterility testing is done. And then labs can purchase these stem cells and birth tissues from these labs, just like a hospital will buy blood. And then if that lab is FDA regulated, they do certain steps to make sure the cells stay alive. That's really important. So after FDA approval, they're cryogenically preserved. Then they're shipped to us cryogenically and placed in our cryogenic freezer right until you come in for the injection. That's very important. So what happens after the injection? Well, the cells are going to differentiate, right? They're going to start forming new whatever you need, whatever joint we're injecting. They're going to start forming new tissue there up to a year. And then they're going to self-replicate. So one of the products we use has 1.2 million live mesenchymal stem cells, and then within 28 hours, you're going to have 2.4, right? Another 28 hours, 4.8 million. And it keeps duplicating, right? Because they self-replicate very quickly if it's human umbilical cord. So then if it's with the knee, now the knee usually needs a little bit more hyaluronic acid. So we'll do a series of 1 to 5 injections of hyaluronic acid or gel injections in the knee starting a week after the stem cell injection. So, and the good part is that Medicare and Blue Cross Blue Shield covers that, right? So we'll go over all that when you come in. So why hyaluronic acid? Well, it's normally found in our joint fluid. It gradually decreases with age. It helps to lubricate and cushion the joint. It's like a pillow in the joint, right? It significantly contributes for the stem cells to proliferate, so they help the stem cells. And it can be done every 6 months. Medicare covers injections up to 5 weekly injections every 6 months. And so that's really, really helpful. And we'll verify and make sure your insurance covers it. That's mostly for the knee because the knee is the major weight-bearing joint. It usually needs more hyaluronic acid than what's actually in our stem cell injections. The efficacy, this is a study done by the National Institute of Health. The efficacy of mesenchymal stem cells combined with hyaluronic acid has been found to be superior to those of mesenchymal stem cells and hyaluronic acid alone. Stem cells and big pharma, look, these are natural. Big pharma can only make money on things they can patent. You can't patent a natural thing. so they're not patentable, okay? So there's no money in this for big pharma. The FDA considers this a natural treatment. The FDA doesn't approve nor disapprove natural treatments, right? They look at food, drugs, and medical procedures, but they do regulate how these cells are housed and processed. So the FDA doesn't get involved in this. And so people get hung up on this all the time. The FDA doesn't approve a lot of things that we use, like our cars, our cell phones, whatever. So they just don't look at this. So it doesn't mean, all the things that I do for my functional medicine practice, that's not FDA approved because it's all natural stuff. So are there side effects to this? No, there's no side effects whatsoever. We're giving you what you already have. You just don't have enough of them. Who would we not do this on? We won't do it on someone who has an active infection in the joint, right? If you're pregnant or planning a pregnancy, undergoing active chemotherapy or cancer treatments, if you're diabetic and your A1C is above 8%, you're too inflamed, folks. This probably is not. You're not going to be happy with the results. And if your joint's been totally replaced. So how many stem cell treatments does a patient usually need? One in almost all cases. Why? Because these cells replicate really, really, really fast. And then if you have a really bad degenerated knee, we're going to highly suggest that you do the hyaluronic acid therapy for a series of 5 injections in addition to the stem cells. It works so much better. And again, Medicare Blue Cross Blue Shield will most likely cover that. How long does the treatment take? It's like 5 to 20 minutes. It's an extremely simple procedure. It's like drawing blood, really. It's that simple. And ultrasound guided in our clinic. After full regeneration how long will it last? After full regeneration takes place, which is up to a year, it'll last as long as it took for that joint to degenerate. Years and years and years. But you got to do the range of motion exercises too. That's really important. Because if the joint doesn't get the motion back, it's going to continue to degenerate. It doesn't hurt, folks. It's like drawing blood. How fast will I see results? About 15% of you are going to see it immediately. That's what happened to me with my plantar fasciitis and my thumb. My knee and my shoulder took a few weeks before I started feeling it. 80% see results by 8 weeks, and most of the tissue regeneration actually occurs between month 3 and month 8, and improvements can take up to a year. Again, these are the 6 points that I made points on earlier. This is a very important slide. You can look at it, stop it if you want. And then I believe it should be ultrasound guided too. Now I'm going to show you a few testimonials of actual patients that came into our clinic and got really, really good results. Okay, we're here with Gloria, and Gloria, you're at your 8-week checkup you had the injections done in both knees, correct?
Correct.
Can you tell me how bad your knees were when you first came here?
Okay, I had very sharp pains on both of my knees. I had difficulty bending, and the main problem I had too was sleeping. I would sleep in one position and it would actually wake me up whenever I went to turn or change positions. The pain would be very sharp on my knees.
And how is your pain today, 8 weeks after the injections?
The pain has improved. I am able to sleep, which is really, really a big plus. Sleeping through the night, and I'm not waking up several times during the night while I reposition.
And about what percentage would you say the pain has gone away?
At this point, I would say between 75 and 80%.
Okay, fantastic. You glad you got it done?
Definitely, definitely.
Okay. Go ahead, John.
My name is John Lindquist. I'm 59 years old. I'm a union carpenter for 39 years. On my feet pretty much for the entire time that I'm working. 18 years ago, I twisted up and hurt the meniscus on the inside of my left leg. Been suffering with pain for that duration. Came in 6 weeks ago and got the injection in my left knee. Instantaneously, it felt like pressure came off. And after 6 weeks, I'm about 80% to where I get through the day and I forget I even have a knee. It's been fantastic, and I'm glad I came.
I think that's awesome. So, Christine, how old are you, first of all?
I'm 72.
72, and you came to us with a lot of back pain, right?
A lot of lower back pain, yes.
And you had the stem cells done about 6 weeks ago?
Yes.
Okay, and on a scale of 0 to 10, when you came into us, how much would you say your back was bothering you?
I would say it's closer to a 10, but at the time I came in, it was like 8, you know.
8, okay. So now we're 6 weeks into where, how much of that back pain is gone after the injection?
All of it is gone.
All of it is
All
gone?
of it is gone.
Okay, pretty excited about that?
Yeah, I'm happy because I can move around. Like I said, this week now is the week that I'm able to do a little dishes, cook a little bit. I wasn't doing any of that at home, nothing.
Right.
So, and I just sat in the chair, not good. I'd move around, it would kill me. I'd go back to that chair.
Okay, and all that's changed for you?
It has changed, it really has.
All right, awesome.
Okay.
Thank you so much.
You're welcome.
Okay, we're here with Lawrence. Lawrence, tell us your experience about the stem cells with your knees.
Well, my name is Lawrence Robinson. I'm 53 years old. I work at U.S. Steel. I haven't been able to bowl because of how bad my knees was, bone on bone with arthritis. I got the treatment. I was able to go bowling a couple of weeks ago. Did pretty well. So,
First time in how many years?
ooh, first time in like 10 years I was able to bowl 3 games.
So,
So yes, it's definitely a life changer for me. I am so happy.
thank you.
After 9 shoulder surgeries and 7 shoulder dislocations, there was so much pain I could hardly sleep at night. So
All in your shoulders.
my shoulders and lower back.
Okay. So when you first came here, how high could you lift your arms above your head?
Not very far. I was having a lot of trouble at work.
Okay, so here we are 8 weeks later. Lift up your arms for me. And what did you just tell me that you can do now that you couldn't do 5 years ago?
I could not lift my track fast guns. They're fairly heavy. My screw guns I had no strength. I had to use both arms to do my work. And I've just in the last 5 weeks, I've realized that I have no problem doing it. I don't even think about it. It's just coming back to me. And no pain at night.
Your pain's pretty much been gone since injection day, has it not?
Yeah, the first couple of days, all the pain went away and I started sleeping like a baby.
And now 5 weeks in, strength's coming back.
The strength's coming back and hardly any pain at all. And I'm doing the work way faster than I've ever been able to.
That's awesome. That makes me happy. Thanks, man.
Yep.
Okay, so let's talk about cost. You all have that on your mind, right? Because only you can answer the question, is it worth this to get rid of this, right? So the investment, you're actually buying stem cells and you're buying, exosomes and hyaluronic acid, but what you're really investing in is your quality of life, right? Motility and independence. Just imagine what life would be like if you didn't have what you have, the things that you can do and enjoy. So what's it worth to you? And these things are degenerative. They only get worse and worse with time. So 4 body parts is $18,800. When we buy that many cells from the lab, we get a discount of $3,000. And so then those of you who have watched this video in its entirety, you come in, you're already like, no, I don't have to answer you already know a lot. So I'm going to give you a $400 discount. Make sure when you make the appointment, you mention that you've watched this video in its entirety. So 4 body parts is $15,400. If you decide to do, that's for stem cells. Hyaluronic acid, if you have Medicare and Blue Cross, especially for the knees, we're going to recommend that should be covered. Now we use care credit. These are care credit options for you at that cost. If you got, for that amount, you need really good credit and decent income. So you can look at these, and we do the approval process right in the office. It takes like 8 minutes. For 3 body parts, it's $14,300. Then the multiple body part discount of $2,100 for 3 body parts. And then if you watch this video in its entirety, let my staff know when you call that you watched this, you get a $400 discount. It's $11,800. Again, that's for stem cells, right? The hyaluronic acid, we like to do, really recommend for knees. Some people want it for other joints and they'll pay out of pocket. We'll go over that when you come in. But Medicare and Blue Cross will cover it for knees. And then 3 body parts, this is the options that you have available to you through care credit. The first 2 are interest-free, right? So we'll go over that when you come in for the consultation, if you're a good candidate and if you want to do it. And then 2 body parts is $9,800. Multiple body part for 2, discount for 2 body parts is $1,200. And so the seminar discount voucher, if you watch this video in its entirety, is $400. Make sure you let my staff know. Brings it down to $8,200. So this is the cost for stem cells. If you need hyaluronic acid for knees, Medicare Blue Cross should cover it. Other insurances won't, but we can go over all of that. You don't have to get the hyaluronic acid. We do strongly suggest you do it for knees because it's just a joint that just takes a lot of pounding. And we found over the years that the two together is like really, really works much better. So this is the investment, 2 body parts that we usually need to do for lower back also. And in our clinic in Tinley Park, we offer included in the fee spinal decompression treatments too to really help and facilitate the healing for compressed discs and disc herniations. So Care Credit, these are the options that you have for 2 body parts. You can stop the video if you want. We do this process right in the clinic. Like I said, it takes like 8 minutes. And then 1 body part, 1 knee, 1 hip, neck, shoulder, whatever, $5,300. Again, let my staff know that you watch this video in its entirety. There's a $400 discount, brings it down to $4,900. And again, that's the cost for stem cells, not hyaluronic acid. If you have Blue Cross Blue Shield Medicare, hyaluronic acid should be covered by that. And if it's for knee, we're going to strongly suggest that you do that. Other joints, it's not all that necessary. Sometimes it is, very rarely though, but mostly for knees. Okay, and here's the options for Care Credit for 1 body part. All right. So what's next? So step number 1, call and schedule a 30-minute consultation. It's free. There's no obligation. Calls are answered 24/7. We can do it face-to-face if you're in the Chicagoland area. If you're outside the Chicagoland area, we can do it via phone or Skype, okay? If you're outside the Chicagoland area, they're going to email you paperwork that you're going to fill out and send back to us electronically, and then let them know that you watched this video in its entirety. Here's the number, 708-614-1222. Let them know you watched the stem cell video in its entirety to get scheduled for the free 30-minute consultation. No obligation, folks. I'm just going to be upfront with you. Yes, you're a good candidate. No, you're not a good candidate. Now, by the way, if you come into the clinic, I want to take x-rays, and that's all included too. So the purpose of the consultation, I'm going to answer any of your questions. We're going to discuss your areas of degeneration. What's the best strategy? Because sometimes you don't need all the areas that you're getting. If you don't have a lot of people come in with knee problems and the opposite hip is bothering them, but the hip's not degenerated. The hip is because of the knee. So they think they need both areas, and we just really need to do the knee. So we're going to determine if you're a good candidate, and we're going to discuss, the best possible strategy for you. So if you are a good candidate, we're going to get all the necessary forms we need to have you fill out and sign if you're virtual electronically, and our staff will go over the whole hyaluronic acid and how that we can work that in if you have a knee issue. And the payment method needs to be determined, and cash payments have to be done face-to-face. And all virtual patients do not pay the clinic you're going to. If it's not our clinic, you don't pay that clinic. You pay us, and then we pay them. That's how that works. Okay. If you are a good candidate and desire the therapy, do you want to do Care Credit? We're going to apply for that if you want it right in the clinic. This can be done by our office only if you're in person. If you're at home, this is a virtual type of situation. They'll teach you how to do it online. Okay? So, hope you enjoyed the information, folks. I'm going to tell you, I've been doing functional medicine for over 3 decades. I've never seen anything work more effectively than properly done stem cells. And when it comes to the knees, stem cells with hyaluronic acid is just amazing. So schedule your no obligation free consultation, 708-614-1222. Hope you enjoyed it. I'm Dr. Ed Beyer, and I hope to meet you soon.